This pandemic won't end at home until it ends worldwide.
The United States and vaccine inequality. Rich nations are snapping up injections while poorer countries struggle to meet demand. Hello, I'm Arnold Naidu and this is The Heat. Vaccinations are ramping up in the United States, but President Joe Biden warns the country is still on a war footing. Meanwhile, in Brazil, hospitals and morgues are being stretched to the limit, and the prognosis for other low-income countries is similarly grim, as vaccine distribution continues to be a major challenge. There's much to discuss. Let's bring in our panel. Joining us from New York, Dr. William Hasseltine is Chair and President of Access Health International. From Los Angeles, Dr. Gary Richwald is a communicable and infectious disease expert and the Medical Director of Curative California Vaccination Project. Gustavo Ribeiro is founder of the Brazilian Report and joins us from Sao Paulo in Brazil. And with us from Boston, Dr. Yanir Bar-Yam is president of the New England Complex Systems Institute and co-founder of the COVID Action Group. Welcome to all of you to the show. And Dr. Hasseltine, let me start with you. Let's start with the availability and distribution of vaccines around the world. Inequality to access vaccines remains a big issue. This is the Secretary General of the World Health Organization talking about it. Let's listen.
Scaling up production and equitable distribution remains the major barrier to ending the acute stage of this pandemic. It is a travesty that in some countries health workers and those at risk groups remain completely unvaccinated.
So, Dr. Hasseltine, according to the Washington Post, the world's richest countries control 80% of available vaccines, and low-income countries have, in some instances, only been able to access about 1/10 of 1% of the available vaccines. So, how do you see that being resolved?
I think it will be resolved as the richer countries vaccinate their population. I think if you look at it from the political leaders' point of view, it's extremely difficult to ship large amounts of vaccine abroad when your own people aren't vaccinated, if you're the ones making the vaccine. There is, of course, an exception. China has great potential to produce vaccines, and it has virtually no COVID. So it would be my best candidate to ship the largest amounts of vaccine. India, of course, is a very large company with tremendous vaccine capability. They produce about half the vaccines in the world, but they have an enormous problem right now. So I think there is going to be, for some time, inequities in distribution.
Dr. Yanir Bar-Yam, no country, of course, has been spared by this virus, but some have managed it. We have seen that. Some have managed it better than others. It's also having a major negative impact, of course, on economies around the world. The United States Treasury Secretary, Janet Yellen, she talked about this, making the point, and we've heard that before, we just heard it a moment ago, that no one is safe until everyone is safe. This is what she had to say.
Many middle and low-income countries are in a different place, lacking the finance to support their economies and people during COVID-19. What's less obvious but equally true is that this divergence would also be a problem for America.
So, Dr. Bar-Yam, the fact that these vaccines are not being distributed more equitably, is that extending the duration of the pandemic, and is it making it worse?
Well, one of the key issues is the Brazilian variant that arose there because of the large number of cases there, which also affects everyone. It may at least partially undermine the vaccine. We don't know yet, but it is already present in the United States, in Canada, and in Europe. And so the risk that a variant will arise that will then undermine the major efforts of vaccination is very present. And of course, that's only one of the implications of having a virus that's global and transmitting globally. But that's an important one when we're relying so heavily on the vaccines as a method for reducing the impact of the virus.
What are the alternatives, or at least not the alternatives, but what should be done in addition to the vaccines?
Well, we know how to control the virus. And in fact, the statement that China doesn't have the virus that was just made before is because they controlled it. So did Australia and New Zealand and Vietnam and Taiwan and so on. The point is that we have the ability to control the virus. It's always been a choice, but it's a choice that we haven't chosen to execute. We've gotten the virus down and then opened up because we believed that there was a trade-off between economics and health. And that's been shown simply not to be the case, because once we can get rid of the virus, then economies open normally. And the economies of those countries that have eliminated the virus in Asia and in Oceania have done it much, much better than other economies that have tried to live with the virus, believing that that would save economic activity, where it has, in fact, not. It's caused the tremendous amount of harm that we've experienced over the last year.
Right, I want to get back to that point of what other countries have done, but I just want to bring Dr. Gary Richwald into the conversation right now. Gary, there's almost 170 million Americans, according to the CDC website, who've had at least one shot of the COVID vaccine. President Biden says he hopes that there would be 200 million people who had been vaccinated, at least one shot, on his 100th day in office. That's not far away. That's about 22 days. He looks like he's on target to meet that deadline. But we also heard some disturbing news. There was a poll done by National Public Radio which showed that 1 in 3 Americans say they will not accept the vaccine. And there's a range of reasons for it. Some political, some health, some people don't trust the government, etc. But can the country overcome the pandemic if 1/3 of its population say they will not take the vaccine?
Well, of course, the answer is it depends which third.
Yeah.
And that's where the United States is in very tricky territory. For the most part, we would say maybe half to 2/3 of our frontline workers, of our healthcare providers have been vaccinated. But that leaves a large number of people in the non-170 million that you mentioned earlier. And many of those people have a lot of contact with other people. They're often young adults. And you know, the bottom line is, the longer we drag out the vaccination effort, the greater the opportunity for misinformation and straight out lies, and politicization of vaccination just becomes larger and larger. You know, first we politicized mask wearing, then we politicized vaccination, and now we're politicizing vaccine passports. And so I think the United States is not setting a good example for the rest of the world. We need to get people vaccinated now. And it seems like health equity has been thrown out the window, frankly, when we start having states just saying anybody can be vaccinated.
But has the president got the right approach right now, Gary? Because, you know, as you point out, the longer the rollout goes on, the more the chance of misinformation getting around. But now we're seeing up to 3 million people being vaccinated on a daily basis. President Biden says he hopes that'll be 200 million on his 100th day. So is the country on the right path right now?
You know, you have to interview the virus. And that's one of the most troubling issues here. It's not so much how good the vaccines are, it's what the virus is going to do. And of course, the answer to that question is we don't know. And because we don't know, we better have in place a testing system, a contact tracing system, all of the things that have largely receded into the shadows of our public health efforts. So yes, Biden's done the right thing in terms of vaccine, but there's a much bigger picture in terms of being able to prevent what may occur over the next 3 to 6 months.
Gustavo Ribeiro, Dr. Yanir Barham a moment ago talking about the situation in Brazil. And if we look at the situation in Brazil, it's now become the epicenter, really, of the worldwide pandemic. 4,000 deaths recorded in just one day in the country. And we know that the healthcare system in Brazil is stretched to the limit. Yet we have President Bolsonaro, who's downplaying the seriousness of the crisis in the country. This is what he said recently. Let's listen.
Now the discussion is whether I am going to vaccinate or not. I will decide. I've already had the virus. I will get vaccinated when the last Brazilian gets vaccinated. Then I will decide whether to get vaccinated or not. That is the example a boss should set.
So, Gustavo, give us an idea of what the situation is like in the country.
Wow.
Well, Brazil is undergoing what we could say a pandemic perfect storm. We have economic anxieties which are pushing people out of their homes because we have an extremely informal economy. So for a lot of people, staying home is not an option. They have to go out and they have to make ends meet and find a way to earn their living. We have an uncontrolled spread, also because of pandemic fatigue. A lot of people who could stay home simply won't. Vaccination rollouts in Brazil are extremely slow. We have vaccinated around 10% of the population with at least one dose, but less than 3% with both doses. Several state capitals here have suspended rollouts because of a lack of inputs and a lack of doses. And we have a government that has, from the beginning of the pandemic until now, sent mixed messages to citizens, has been a vector of disinformation. The president has talked against mask use, has talked against vaccination rollouts. And you said 4,000 deaths confirmed yesterday. Health ministry officials have told us that they expect within a span of 2, maybe 3 weeks, that daily tally to get to 5,000 at least. And now we are not only facing a health collapse, but another collapse of the funerals, the funerary system, because a lot of cemeteries simply are not being able to cope with the sheer demand that they have right now.
And Gustavo, what about the situation deep in the Amazon, in cities like Manaus, for instance? What's going on there?
Well, Manaus, for instance, the biggest city in the Amazon, suffered 2 collapses, one in March, April last year, and one at the beginning of this year. The number of deaths has slowed down a little bit because the government was forced by political pressure to ramp up vaccination rollouts there. And it is one of the states which have the highest rates of vaccination. But last year, we saw in some regions like the Amazon, like poorer regions, the coronavirus spreading faster. And now we're seeing a generalized spread of the virus and a generalized state of near collapse for health reasons, for health systems. And I spoke this week with the president of the Brazilian Virology Society, and he was telling that at this point, Brazil is becoming a sort of petri dish for new variants. There was a recent study that was published last week with 11 mutations found in a handful of people. So while these are not prevalent, if we don't control them fast enough, they could become widespread, like the Amazon variant or like the British variant.
Dr. Yaniaba, you were talking about this earlier on, and as Gustavo tells us, that this virus is mutating all the time. So there may be more than just one variant or 2 variants. There could be up to a dozen, couldn't there?
Yeah, what we're doing right now is we're labeling or naming variants. The UK variant, the Brazilian variant, they have technical names too, the South African variant. But the way to think about it is that the variants we're concerned about now are the ones that happen to be growing rapidly, so we see a lot of them. But no matter where you look, there are more and more variants, more and more mutations, and there's this cloud of these variants. And so rather than thinking about it as 1 or 2 or 3 variants, we have to understand that there are many variants out there, and depending upon what we're concerned about, we will identify different variants. And so if we're worried about the rapidity of spread or how deadly they are, or whether they spread in children more aggressively or cause more effects on children, that's the kind of thing that we've been seeing in these variants. But the variant that's going to be the most important variant pretty soon is the variant that can evade the vaccine, because if vaccinated people get together, then that's when those variants will transmit. And if it undermines the vaccine, then the strategy that we're using in the United States and in much of the world is not going to be effective. And in fact, unfortunately, that's what people are projecting. They're projecting that the disease will become endemic, which means that instead of having the vaccine stop the virus from transmitting and getting to the kind of situation we have in China and Australia and New Zealand, they're expecting it to bypass the vaccine, and that we'll need next generation vaccines, or we'll need new vaccines, and all of that is kind of programmed into how people are thinking about the process.
Right.
There is, of course, the different way, which I can just mention briefly, which is that if we use vaccination to get rid of the transmission, then we can achieve elimination, as has been done in other places.
Dr. Hesseltine, that brings us back to the point I was talking about earlier on, with 1 in 3 people here in the United States, according to this polling, telling us that they will not take the vaccine. I mean, what can be done about that? How does one convince people that this is for the common good? I mean, could one put some kind of strategy in place?
Well, the obvious strategy is make it compulsory for various activities, schools, jobs, hospital workers. Certainly that is the case for many vaccines today. You cannot work in a hospital today if you don't have a hepatitis B vaccine or a hepatitis C vaccine, and then a whole list of others. You cannot go to public schools without vaccines. There's nothing new about that. And in fact, as far as travel goes, I remember very well the yellow cards, where you couldn't go to many countries unless you showed your passport for yellow fever or smallpox or polio or you name it. You had to have that yellow card. So that's all possible. But I'd like to reiterate something that has been said a few times now.
Yeah.
And that is, we can control this pandemic, even without vaccines or drugs. We will have vaccines. We have them. We will have very effective drugs. But you have to couple that with public health. And I'm very disappointed at this point in this administration that isn't putting the same effort into laying the groundwork and making sure we have the infrastructure so we can rapidly test. Britain is going to have tests, so every person in the country can test themselves twice a week. Twice a week. That's what we should be able to do in homes, workplaces, et cetera. And then follow that up with contact tracing and isolation. I call it assisted isolation. I've written about how we should make sure people have the economic means to stay home with their families if one member is infected for a reasonable period of time, whether that's 10 days or 2 weeks. We should subsidize that, make it possible, make sure they get the care they need. But if we don't do that, as you've heard, the variants can take over or other issues can get in the way. And it's been extremely disappointing to, I think, all of us who you're talking to right now, to see the response, not only in this country, but in many other countries, with respect to the basic ABCs of public health. You need vaccines, you need drugs, and you need to have public health measures to control. And that's very simple: identification, contact tracing, and assisted isolation.
Gary Richwell, what are your thoughts on that? I mean, we've heard President Biden say, or warn rather, that it's premature to lift restrictions right now. He's appealed to people to wait just a little bit longer. He's also moved up that deadline for states to make all adults eligible for the vaccine by almost 2 weeks.
Well, you know,
go ahead, Gary, can you hear me?
Sure, now I can. Well, Angela Merkel and President Biden have one thing in common. They have a state system in their countries. And we have 50 states, and what Dr. Hazeltine is disappointed about is what's going on in probably 2/3 of the states. Basically, vaccine policy, that is, telling people that you don't need to wear a mask, and you don't need to social distance, and you don't need to have proper hand hygiene because you're vaccinated, has the potential to undo all the benefits of vaccination. Nobody has the political courage to say that. It's so connected that we're not going to get people vaccinated unless we give them some free pass at the end, that now they're vaccinated and the free pass has the potential to put us all back in the slammer in terms of infection with this virus. So, you know, what Dr. Hazeltine just said is I double down on it and say that I'm going to be, you know, I may be back here in a month saying if we had only not said you can do anything, you can travel anywhere. Grocery stores, they're not going to be able to say shoppers have to show their vaccine card.
Right.
Some states are already making vaccine cards illegal as a basis for, entering a particular business. I think Texas did this in the last few days. So these messages are undoing the benefits of vaccination.
Dr. Heseltine, is that the problem here, that there isn't a single policy? There's arguably 50 policies.
Well, that's certainly one of the problems. And I think that if we look ahead to plan for future pandemics, we have to really examine very carefully how we've structured it. I've always said the problems in a pandemic are leadership, and we have good leadership now. But the second problem is governance. We do not have the right kind of governance. And there's a third very deep issue, which is social solidarity. It's almost a no-no word in the United States to even say social solidarity. But without that, it's very hard to introduce and implement sound public health policies. You need all three working in tandem, along with what we do have is excellent science.
Yep.
So we have 2 of the 4 ingredients that you need to control the pandemic today, but we lack 2 essential ones. You can probably get away with bad leadership. We've seen that, and some countries have done okay.
Yeah.
But you cannot do away with good governance and social solidarity. Those are 2 things you really need to have if you're going to control these pandemics. And I think that that's something we have to work on for the long haul in the United States, to try to reform our public health system and try to create a sense of shared value that I am my brother's keeper.
Right, Gustavo, you have something of a similar situation in Brazil, don't you? Because you have the federal government, which issues the guidelines, imposes the restrictions, etc. But state governors have quite a lot of autonomy, don't they, on how they implement those measures?
Yes, but I think we had in Brazil a sort of reverse situation from what happened in the US, which is in here, the federal government bent over backwards to stop governors from enacting social restrictions. And we have the matters taken to the Supreme Court. The Supreme Court had to step in and recognize the jurisdiction that governors could enact social restrictions. Jair Bolsonaro has changed health ministers 3 times, and all officials have one order. There will be no talk about a lockdown in Brazil, even if health experts say that at least for 2 weeks, and at least in state capitals where the bulk of the population live, we should close down the economy for a couple of weeks in order to try and tame what has been a brutal wave of infections. For instance, it took us 10 months to go from 1,000 deaths per day to 2,000 deaths per day, and 1 month to go from 2,000 to 4,000.
And Gustavo, what about public compliance of these measures in Brazil? I mean, are people basically going by the guidelines, or are they just defying them?
There is no public compliance, and in a country like Brazil, as vast as Brazil, with police forces as reduced as we have, you need a lot of public buy-in, and there was a lot in the beginning. But like I said, we have a very informal economy. Tens of millions of people simply cannot afford to stay home. For instance, the city of São Paulo enacted a 10-day holiday, finishing on Easter, to try and increase isolation rates, and they failed. Not a single day isolation rates on GPS monitoring showed more than 50% of compliance, and their goal was 75 at least.
Dr. Yanir Baryam, I want to move a little bit away from this region, from this hemisphere, to Europe. Many European nations still struggling with the pandemic. France and Italy have imposed new lockdowns. Travel to Spain is restricted. And Germany is talking about another lockdown as well. What's gone wrong in Europe?
Well, I mean, the situation there is because of the relaxation of restrictions and the new variants, and the fact that cases have gone up in some countries is leading to them to take new restrictions. There are some positive situations, like in Portugal, and Spain has also taken stronger actions that have led to cases going down dramatically. And they are actually in a position, particularly Portugal, if they were to do some additional restrictions now, they could actually open up as have New Zealand and Australia. Again, it's a matter of choice. And I want to go back to this idea in a very key way. We control the outbreak. The collective of social action, guided by clear information, is able to control this outbreak. And the fact that we have control then raises the question, do we choose to exercise it? And what we've seen, as we've talked about now in Brazil, in the US, and now in Europe, it varies quite a bit what choices are being made. And what we see is, of course, happening is that the outcomes and the process over time, going up and going down in these yo-yo lockdowns, is what results from making decisions at the collective level. I have one more thing I would like to add on this conversation about social cohesion, which is extremely important. But I think part of the point is that when there is clear communication about the choices and about the science, then public can trust what they're being told. And I think a major failure is not just the implicit or the deep structure of the society, but how we appeal to people. And that has not been done very effectively throughout the outbreak.
Gary Richwell, I've only got a minute left, but you know, the only region in the world that's enjoyed relative success in controlling this pandemic is Asia. What have the Asian countries been doing that should be emulated here?
Well, I mean, above and beyond social cohesion, that is, and trusting the government, at least in the public health and medical area, I think they wear masks. Mask wearing with influenza was a long-standing personal choice and often chosen. Social distancing, they did enormous amounts of testing. They made it very convenient, and the contact tracing was in place. So our testing may or may not be able to come back up to the level it's going to be needed if we have an outbreak, if the vaccines begin to fail. And our contact tracing is just abysmal. I mean, we're running in most places at 1/4 to 1/2 of the staffing that's recommended. So Asia did it all right. Textbook, they had experiences with previous pandemics and epidemics. That's what they did. And they did it, I think, with A+ success and the success that followed.
Okay, and that's where we have to leave it. Thanks to all of you for being with us on the show. That is it for this edition of The Heat. I'm Arlen Naidu in Washington, D.C. Thanks for watching.